Good afternoon, ladies and gentlemen. Let us just give colleagues 2 more minutes and we will start at 5 past. Okay. I think we have a good number of colleagues that have already joined, so let us proceed. Welcome, ladies and gentlemen, to the 4th and last of the RISA Learning webinar series. And today we are accompanied by a sign language interpreter, Wakio Njeru, as well as Daniel Ndambuki. So I hope that those that are hard of hearing will find it's easier to follow today's conversation. My name is Mpoma Mabolo, and I have served as a technical lead on the RISA Fund for the last 4 years, and I will be moderating today's session, which is focusing on gender equality, disability, and social inclusion. Today's webinar will explore how GEDSI principles are critical in shaping the future of research and innovation. And members of the panel today they have experience on how they have incorporated these principles in their work, and they will be sharing their learnings. And you will also have an opportunity to engage them towards the end. So we will start with a keynote address from the Science for Africa Foundation. Thereafter, we will have 4 speakers coming to share their experiences. This will be followed by questions from myself, and I'll also open it up to the floor for any questions. Please note that you can put your questions in the Q&A. You can use the Q&A option, and the colleagues can go in and vote for the questions, and the question that is appearing at the top of the list, those will be the questions that we then are able to ask. This is in case there's a lot of question coming up. So I only had 5 minutes to introduce the topic. So I am going to give over to Fatu from Science for Africa, and she will be sharing with us on how Science for Africa is championing inclusivity in research and innovation. Fatu, welcome. Please start by giving a brief introduction of yourself and get straight into your presentation thereafter.
Great. Thank you so much. I'm really delighted to be here with you all. My name is Fatu Vadian, and I am a program manager at the Science for Africa Foundation. And I will go, once I get into my presentation, I will give a little bit more background on my organization and the different projects that we have across Africa. My background is in immunology and cancer biology, so I'm also a researcher, and really, again, excited to be here with you all to speak about this topic, which is really well integrated into how it is that we conduct our research. So I hope that I'm audible, and if my slides are up, I can go ahead and get started.
You are very audible and your slide is up.
Okay, great. So please move to the second slide. So just to give a little bit of background, the Science for Africa Foundation is a Pan-African nonprofit public charitable organization. And it was created to support, strengthen, and promote science and innovation across Africa. So we have a vision of strengthening African science, not only for the continent, but also for a better future in a global world. And our mission is to catalyze and strengthen the science and innovation ecosystems across the continent to respond to sustainable development challenges and to impact lives positively. Next slide, please. We focus across three different areas of the research landscape. So looking at primarily discovery sciences. So that's, basic science that you would do kind of in the lab, addressing a research question. Translational sciences, how is it that you take that science kind of from out of the lab and influence the real world, either making a product, making a new method, or maybe even making a new policy. And implementation sciences, which is kind of, how is it that you're taking those findings and, directly implementing them or directly acting on them in the real world. We focus on three different thematic areas. So as an organization, we focus on health. We also focus on climate and environment, and we also focus on agriculture. Next slide, please. Within our organization, we also have 4 key values. So respect, excellence, diversity, equity, and inclusion, and accountability. And I'm going to focus on diversity, equity, and inclusion, which is how we describe basically GEDSI and the main topic of the discussion for today. So our values are integrated not only in how we carry ourselves as an organization and our work culture, but also thinking about how it is that we implement our different programs and our different research areas and kind of who is involved in those. Next slide, please. So the main initiative that I manage is called Grand Challenges Africa. And as part of this initiative, we promote African-led science and innovations. And we do this by awarding seed and scale-up grants. So with Grand Challenges Africa, we focus on the entire innovation ecosystem, looking at early stage seed research, what we call transition to scale. So how is it that you now take that research out of the lab and into the real world? And then also what we call scaling, which is how is it that you make now broader impacts to either have that research influence different countries, different regions, different ecosystems. Next slide. Some of the different thematic areas that we cover under Grand Challenges Africa, and we have, a variety of them. are maternal, neonatal, and child health. We also look at drug discovery. We even had projects under COVID-19 when the threat of the pandemic, was very eminent across Africa and across the globe. Some of the more recent focus areas that we have also include artificial intelligence, and I will show you some examples from that, and also looking at the intersections of climate and health. So now I'll get into some of the examples that we have from our different research cohorts under Grant Challenges Africa. So next slide, please. So the first cohort that I'm going to present to you is what we call Modeling for Health in Africa, or MODHA. And this is one of our more recent cohorts. And this cohort focuses primarily on looking at disease modeling and how it is that you can take those outcomes and influence policy with them. So, a very quick example is, if you are seeing changes in mosquito populations due to climate change, that might impact public health policy in what diseases you are looking for. Maybe you're looking more closely at malaria or chikungunya or like other illnesses that are carried by mosquitoes. I see the slides are done, but I will continue, so that's okay whenever you're able to get them back up. As part of this cohort, thinking about how it is, that we look at gender, equity, disability, and social inclusion, we have a project in South Africa, which is led by the PI there, Professor Nikki Tiffin, and she is looking at infectious disease and non-communicable diseases and how they can interact and affect maternal, neonatal, and child health outcomes. And she's specifically doing this looking at gestational diabetes as a case study. And from this work, she hopes that she can now also develop guidelines from the health modeling to also inform different policies, for working with pregnant women and some of the other challenges that they may face during pregnancy. Next slide, please. Looking at our climate adaptation in African agriculture cohort, this is a really diverse cohort that is looking at many different issues at the intersection of climate and agriculture. And two examples that I'm going to provide are from a project in Benin and also in Uganda. So in Benin, we have the PI who is there, Jalal, and he is looking at how to basically provide more information on climate smart agriculture, especially in vulnerable and rural regions of Benin. So how is it, that you engage with those populations there, really interact with them as stakeholders, bringing examples to them of how they can grow new crops, how they can look at nutrition in the crops that they are already producing to really benefit those communities. In Uganda, we have our PI there, Barbara, and she is working with youth, looking at what we call the chicken value chain, basically, chicken rearing, production, and then also the sale of chicken or their eggs in Uganda and Burundi. And she's really been engaging with these youth in a really nice way to look at them as innovators and understand from their perspective, what is it that they can bring to the chicken value chain to improve this agricultural process. Next slide. Looking at now our AI for Global Health cohort, and this cohort looked at how it is that you can design AI and digital tools to basically tackle some of the inequalities across diverse populations, focused on improving health. So an example that we have from this cohort in Ghana, they're looking at maternal pre-eclampsia and how can you detect that, especially early, using AI to also now allow for equitable access. So then you can have diagnostic capabilities, especially in areas where you have limited resources. In Uganda, there's a project called Mama Ope AI, which is a wearable diagnostic device, and that uses AI for detecting respiratory illnesses. And right now it's being used by frontline workers, again, especially in low resource settings. So then they have access, for diagnosing their patients. Moving now on to the next slide, please. Our climate and health cohort. Here, these researchers focused on understanding the health impacts of climate change, but especially now also looking at the intersection of climate, health, and vulnerable communities. So looking at women, looking at rural populations, and looking at disadvantaged populations. Here, there are two projects that I want to highlight. One in Kenya, where they're looking at community-centric early warning systems. So how is it that you can create systems, especially for rural communities, so that they can have warnings for climate-related hazards and be prepared for them? In DRC, our PI there is working with women and youth as community leaders for vector-borne or mosquito-borne illnesses. So looking at how is it that you can use these groups for capacity building in science and in public health. And then one more example I will quickly give is in Burkina and Cameroon, where they are building an antimicrobial resistance antimicrobial resistance in maternity wards that are serving vulnerable populations. So again, once you have that data, then you can make informed decisions on how better to treat those populations. I'll go through the last slides a little bit quickly in the interest of time. So next slide, please. This is another example of one of our projects which took place in Kenya with a PI by the name of Christine Musiyimi, and she worked with traditional birth attendants in rural areas looking at mental health and pregnant women. So how is it that you can detect cases of depression early and then also now have interventions for better outcomes in those women? Next slide, please. For my last two slides, I'm going to just quickly go over some work that we're also doing as part, not as part of Grand Challenges Africa, but as part of our mental health portfolio, looking at how we engage with people with lived experience in research. So here we've developed a really nice program around a partnership between SFA Foundation, Africa CDC, the Pan-African Network for Peoples with Psychosocial Disabilities, and a few other partners and collaborators to ask questions about how can we look at people with lived experience to help them shape research? How is it that we can capture African voices? And how is it now we can bring all of this together when working with African researchers? And the primary goal is to impact policy and to change frameworks around mental health, specifically for those who are directly impacted. So next slide, and this is my last slide. So from this work, we have several ways that we're kind of feeding in information on developing good practice for engaging with individuals with lived experience, how we're modeling also collaborative research practice. So how is it that you can work directly with those communities who are affected? And also looking at larger organizations like SFA Foundation, Africa CDC, and what role we can play looking at how to develop better frameworks for this. All of this will feed into we hope, broader adoption of inclusive research, especially in Africa. And then finally leading to new, improved, better mental health services that can really respond to the needs and priorities of the communities that are most effective. So the main outcomes we hope to come from this are to build research capacity of those with lived experience, to fund qualitative research, and to also host roundtables where we can even discuss areas outside of the research, like safeguarding, looking at the intersection of climate change and mental health, confidentiality, informed consent, and other really important issues that we need to take into account. And that's my last slide. So thank you very much.
Fati, thank you so much for sharing those experiences. For me, as somebody who has left research as a molecular biologist, I'm feeling better knowing that there are people out there throughout the continent working to solve challenges that are affecting us as a continent. So good work, and may the works of SFA continue. And I'm sure there's a lot of people here wondering, how do we get in touch with the Science for Africa Foundation? And I believe we'll get details from you so that we can share with them. I mean, even the next speaker, he'll be speaking about how he's contributing towards maternal and neonatal healthcare and how they've navigated those challenges in rural communities. So I'm sure he's thinking, how do I become involved? But thank you so much for that. There's a poll that has been put out. I don't know if everybody has managed to get it. And the question there is, in your innovation and research work, which aspects of GEDSI have you engaged with? So you could just select and then submit. I believe later on, someone will come and give to us those results. Right. So next, I'm going to invite Professor Jude Igumbo. He is a professor at the University of the Witwatersrand, and he has been leading the Dimmer Health Project funded by the RISA Fund. Jude, please go ahead and share with us how you've worked with communities in improving health systems in South Africa. Over to you.
Okay. Yeah, thank you very much, Victoria. Can you hear me?
Loud and clear.
Okay, and thanks to everyone who has joined. I'm particularly thrilled by this opportunity to share the work we have done with support from FCDO RISA program, and also acknowledging the partnership of Chemonics that was with us through the entire journey. I will be focusing mostly on maternal mortality in my presentation. And for us, maternal mortality is often framed as a medical problem, but in reality, it is fundamentally a social and economic inclusion challenge, just wearing a medical mask. And as far as we begin to recognize that, maybe we'll move closer to how to address it. And as it is at the moment, women in Africa face almost a lifetime risk of maternal deaths of about 1 in 37 times. And this compares to 1 in 5,000 in higher income countries. So we have a huge problem with maternal mortality in Africa. But this also doesn't take away that progress has been made from what it used to be 10, 20 years ago. But our attempt at meeting the SDG target, we're still very far from it. As a region, we are still sitting at almost 7 to 8 times what the target should be by 2030. And at this rate, we may not be able to meet those targets, not because we cannot. Oftentimes, it could be the approach that we are taking or the intensity of that approach, which I believe is the real challenge. And how then do we begin to rethink our solution in addressing the problem? As we know it, the reason and the drivers of maternal mortality, occur at multiple stages. One is at the individual level, and the next level is the interaction with the entire socioeconomic environment, and the final step is possibly where they interact with health services. And this will manifest in terms of barriers to accessing health services, which could be in the form of transportation, long waiting times when they arrive at those health facilities, financial constraints that start from the household to engaging with health system, or even arriving there can also be a problem. And by the time also people arrive at most of our health facilities, they are often overwhelmed by the high burden of disease in Africa, not just in maternal health, but across the board. And this burden and pressure on our system almost creates a vicious cycle whereby the burden itself, continually perpetuates the need or the problems that we face, either in the maternal health space or any other space for that matter. And addressing this problem for us would mean that we begin to think of how to achieve scale. Knowing that a lot of research has gone into this area, such as those have been described already. So to a great extent, we know what works. And then how do we take what works to scale? And for us to do that, we started working very closely with communities to really understand this journey and the interaction with various systems, and how do we learn from what works, and how do we make those solutions reach the kind of scale that will result in the desired impact that we want. In turning the tide, I'm beginning to work towards our target at reducing maternal mortality in Africa. And for this, we are looking at digital tools and looking at community solutions and see how we can bring them together to knowing what works and using technology to scale that. For this reason, we created a number of digital tools, and also looking at things in the community that could benefit from the digital solutions that we have in addressing the problems we've already talked about. So at the beginning, we trained community healthcare workers. These community healthcare workers are people who come from those communities, engaging with them, and also women who use health services. Working with them, we co-created various solutions that address practical problems that they face on a day-to-day basis in accessing health services. And along that line, we created a transportation system where they could book a taxi for those who live very far from health facilities. We still have health facilities where women walk almost 15 kilometers from home to the clinic where they're supposed to get health services, and back, even as far as 8 and 9 months of pregnancy. That in itself is quite risky on its own, never mind all the other challenges that they face. And for that reason, we created a system, a tripartite that involves the local taxi industry or transport owner, and a health service point, and the user of health services. So this way they're able to interact among themselves, either for routine services or for emergency, using these commercial transport systems in a way of getting part of the ecosystem and creating something that will work naturally within the environment that we're working in. And for that, we worked with technology partners to see how do we allow these women save whatever they have, 50 cents there, 20 cents there, easily building up to some money that they can use from time to time to pay for their transportation or get other essentials that they need when the time arrives, regarding either seeking health services or buying what they need to support their children at delivery. So that's how we got to the wallet, the digital wallet that we created. The Easy Visit, it's a tool that we created that we have embedded in health facilities that helps to manage queues and waiting times. And within that, we've also added a clinical triage layer that allow us to flag risk and allow for referral. But even within the system, that one is able to, before engagement with a nurse, the nurse already could have information of why you are coming and how they could help you. Bear in mind that most of these health facilities are overwhelmed by demand for health services. So having information at hand before people arrive would help that encounter to be more meaningful. But also booking before arriving also helps us to manage the demand side with the supply that we have in the health services. Something else we've also done is integrating AI into the system to help with both the triage system. We also use it for report analysis and planning tools that we've built on the system. So with that, we have chatbots and data dashboards we've created as fully AI integrated to help planning and decision making at health facility level, but also program managers at the district level can also use it for better resource management. So based on our experience, we have been able to as a quick win, some of the things we can report are things like being able to report waiting times, from 5 hours, now we've cut it down to 1.6 hours. In addition to that, in our time in the project, we've also been able to meet and support close to 20,000 women and children in a very short space of time. And also the feedback loop, the engagement between the patients and the nurses, or the nurses and the community, collectively helping to strengthen our system. So in all, the systems that we've created is helping to create the kind of visibility where we know where everybody is and who is doing what, and we're able to deal with bottlenecks and to keep the system moving. And that in itself allows for greater responsiveness, because with information being collected, shared, and used for decision making, we can become more responsive to needs. And finally, by working very closely with the communities, either those who come in to work with us as part of the program, or our constant engagement using the multiple tools that we've created, from using USSDs to WhatsApp to mobile applications, and depending on what people can afford and have access to, they can become part of this ecosystem, constantly contributing to the system, to co-own it and also to help make it work better. And like I said, the system is designed, a big part of the problem that we have at hand is more socioeconomic than it is medical. And for that too, one of the great lessons we've learned through this journey is finding unmet needs and turning those into structured job opportunities that we are hoping that eventually at some point we'll be able to convert it into sustainable jobs for women. That way, providing practical solutions to the issue of maternal mortality that we're facing in Africa. So in a nutshell, that has been our journey. We thank FCDO RISA program and also the Chemonics team for supporting us through this journey. We've moved from being a pilot program to a project that is ready for scale through our lessons over this time, also through very strong partnerships we've built with government and communities that has gotten us to this point. And I'll pause for that, and looking forward to further engagement in the discussion session. Thank you to the host and everybody who have joined us.
Thank you very much, Jude, for sharing those insights. Ladies and gentlemen, I am only going to take questions at the end. So if you do have questions, please put them in the question and answers folder. I think that's what it's called. All right. So from Innovating for Women, we want to hear insights from Young Scientists Kenya on their role in empowering young people in STEM. And Vanessa Inziani will share insights from YSK. Vanessa, please go ahead, and please do switch on your camera so that they can relate to the person there who will be talking, and share your insights. Thank you.
Thank you, Victoria. Camera, there we go. Yes. So hi, everyone. My name is Vanessa, as mentioned. Happy to be alongside Daniel as he does the great work that he's doing. I think before I start by what we do at Young Scientists Kenya, I think from the poll that was shared in the chat, it's good to see that we do have people who have engaged in either gender equality or with interacting with people with disabilities, and then also those who've engaged with the youth from marginalized communities. So my presentation will be very brief. However, I look forward to answering any questions that you may have. At Young Scientists Kenya in Nairobi, Kenya, what we do is that Our main mission is to see how we can inspire and empower the next generation of young scientists, innovators, entrepreneurs, researchers, you name it. So what we believe is that once you're able to expose a young person from as early as age 9, 10, they get to be able to carry this curiosity throughout their school life. And this actually shapes them in what they can be able to become once they get to the point where they select subjects for campus or when they get to choose their various career pathways. So at Young Scientists Kenya, we've been doing this from 2018. So this is our 9th year engaging with the young people. So far, we've engaged over 1,000 schools across the country, and these have been secondary schools. 21 of these schools are special needs schools. That just speaks, to our inclusion and diversity goal, which I will get to that in a bit. We've also reached about 250,000 students and trained over 200 teachers on AI. So that's something that we're trying to introduce to schools, how we can be able to also shape the capacity, rather build the capacity of teachers. What we also do that is unique is that every year we host a competition for young people to be able to come up with fascinating innovations. And so far, we've had over 2,300 student-led projects being submitted, and we've had about 282 winners from this, with about 15 of these students receiving full tertiary scholarships for their university degrees. One thing that we like to boast of is that we've had a few students get a trademark and are registered in the country, so they have their fully fledged companies. There are those who have copyrights, and we're